replacement therapy. I think there's a lot of mystery around these three words where people don't fully comprehend it, myself included. So we're going to demystify this whole concept behind HRT, understanding the benefits, understanding the risks, and finding out what's right for you. Dr. Sangeet here with me again. You know, when we talk about hormone replacement therapy, what are the facts and myths? And then you just earlier on, you know, we were just chatting a little earlier on, you said hormone therapy. Maybe you can share your journey and help demystify, because for the longest time, I always say, I don't want HRT because I had certain misconceptions around it. And I'm sure I'm not the only one. So tell.
Yeah, so I guess when you talk about, the misconceptions, a lot of the studies are totally outdated.
Okay.
Right. And a lot of the reference are done with the WHI studies in year 2000.
Okay.
Right. But it's different because, you got to see when you recruit the individuals, it's like their age group that was like from 50 to 70. So average was 61. It's different.
Right.
But because it's like 10 years post-menopause.
And this was 2000.
It was in 2000.
And so I think menopause.
Yeah.
Okay.
And it scared a lot of women.
Yeah.
So that was when they said, oh, no HRT. And even then, HRT, or even if you take it, it's only for 5 years. But I think there's a lot of progress ever since. Okay. So now HRT is basically, I normally use the term hormonal replacement, right? Okay. Hormone therapy.
Right.
And it's like you have a choice, which one you want to go.
Okay.
Whether it's a synthetic, but now synthetic, we have also done with all the Premarin. It's still available in the market,
Yeah.
but many don't use that now.
Okay.
Or the Provera, they tend to go more for either patch, which is still great.
Right.
I also call it like a body identical. And then there's also bioidentical. Sometimes it can be quite confusing.
Right.
But you just have to talk to your healthcare. And
Okay.
a lot of options that's out there.
Okay.
And personally, my journey, when I started doing this, I was very intrigued. That was back in 2008. And, because it was like plant-based. So to me, it was very new. Okay, it's derived from soy, yam. I want to know more about it. And, even when you talk about the delivery, right, the routes, all those makes a difference. The balance between the estrogen, progesterone,
Right.
as opposed to using monotherapy, estrogen only, right? So there are a lot of variations.
Okay.
So it's just replacing. Once your body starts, the hormones are declining, you can just need to replace it. Because to me, one of the factors when it comes to aging, it's actually the hormones.
Right.
Hormones imbalance or declining.
Okay, so what I guess my understanding is what you say it was plant-based. So this is bioidentical.
That is bioidentical.
Okay.
Yeah. So when they say bioidentical, it's like the molecular structure of the hormones that you consume is similar to what your body produces. You talk about, the chemical structure, that you have the carbon, you have the hydrogen. So it's kind of similar. So when I say that it's supposed to be a bit safer, less side effects. But there again, it boils down to your prescriber. Are they trained?
Right.
The prescription, it has to be appropriate.
Right.
What dose? We normally give physiological dose. We don't give high doses. Now, that's when all the issue starts.
Okay.
If, high dose, you're giving only one hormone as compared to this person may need progesterone as well.
Right.
You're giving only estrogen, then you end up with having all the side effects of estrogen dominant.
Yes.
So I think all those, it requires an art of balancing.
Right. So I know, well, having seen you at this point in my life, I won't mention all because I can't remember all, but I'm definitely on progesterone and DHEA and estrogen and all that, and the body.
How do you feel?
And I feel so much better. And I think the first effect for me was being able to sleep. I think that was very important. My sleep is very important. I like the good old days where I can sleep through the night. So that's one of the, other benefits as well, right? So I think that was very pertinent for me. And so like I don't suffer from hot flushes or night sweats or that sort of thing. And maybe it's because I started on this journey early. Before there were any signs, I really started on this journey and having that chat with you, right? Now, we also say that, our mother survived without HRT or hormone therapy. So why do I need it?
Freda, our mothers survive, we thrive. It's different.
And I'm probably homemakers.
They're homemakers. We are like type A personality, our lifestyle, our stress levels, even our lifespan these days are different. We juggle roles, we juggle responsibility. So it's actually different. They may not have required it. And I think a lot of our mothers also, they sort of like, accepted it.
Yeah. Yeah. So and accepted it, and this is a stage of life, right?
And it's like, you can, tough it out. Why do you need? But I guess it's different. So we want to thrive, not just survive. And with the kind of responsibilities, roles that we juggle, surviving is survival mode is not enough.
Okay, I think very important. I just want what you addressed earlier on as well, right? That there are all these options available. Looking at your prescriber, there's synthetic, there's bioidentical, there's but then the doctor will be able to bioidentical, and what was the other one again? You were sharing
The body identical.
body identical. So these are things that you need to talk to your doctor a little bit more and maybe ask them, right? What's the difference and what suits you? Okay. Again, you also brought, how long do you have to be on this therapy? People say, is it forever?
Yeah. Okay, so when it comes to hormones, first thing is, for me personally, I don't believe there's one size that fits all. For me and my clients, I tend to go for very tailor-made, very personalized, based on your lab tests, based on your clinical symptoms, rather than one size fits all.
Right.
Because I feel we're all very unique. Freda, when you do your blood test, when I do my labs, it's totally different.
Yeah.
You are unique in your way, so am I. So that cannot be what I...
How we react to stress is very different as well.
Absolutely, absolutely. So what you require, what I require is different, different dosages. So I prefer it when it's more tailor-made.
Right.
Now, how long, that is something I normally give an option to my patients.
Okay.
Right? It depends. We look into the risk factors, we look into the family history. So those were the days that they will say you take only for 5 years.
Okay.
But now, there's this Menopause journal, I think was last year in May 2024. Now, this was basically based on, using the hormonal treatment on women past 65 years.
Okay.
Now, the studies have shown that basically women, they tend to have all these vasomotor symptoms, which is like hot flushes,
Okay.
about 40%.
Okay.
It's about 42%, I think. So this is between 60 to 65.
Oh, right.
So this necessitates them to use the hormone treatment.
Right.
Right? But preferably in transdermal or vaginal route.
Right.
Not
Okay.
oral, because it's safer. Right?
Okay.
And then the studies have also shown, if women continue past 65, you tend to, when you talk about bone density, it tends to, help. It aids in it by about 3 to about 4.5 or 4.7%.
Okay.
And it reduces the risk of fracture from osteoporosis, hip fracture by 33%.
So this is already menopause already.
So this is beyond. So this is about age 65 and above. So these are all the latest studies, the Menopause journal that they have done to say that, look, these are all the indications on hormone treatment in women past 65 years.
Okay. So these are the studies that have shown, I think like it helps that you, like I work out, right? I do weights and I want to do this for the rest of my life to be strong. But the thing is, you still need, I think the one important thing is get your blood test done regularly, at least once a year, right? Yes. Then that will be a clear, you can say I'm doing all these things.
Correct.
But the blood test doesn't lie.
The blood test doesn't lie. But also one thing when it comes to the blood test and all that, it could be like a snapshot.
Yeah.
Right? So we have to treat the patient overall. Look at their clinical symptoms, look at their signs, look at their labs, treat them overall. Not just the lab, not just the symptoms. We have to treat them overall. And I think the way to go is at least annually, do a blood test.
Right.
So that, and especially if you are taking the hormone treatment, you need to monitor.
Okay.
Right? You need to monitor your symptoms, you need to monitor your labs, and just make sure that it's where it should be. It's not too much, physiological dosage and levels.
Okay, I'm just gonna close off with this question, right? And you sort of addressed it, but I'm sure people just want to know, like, long-term effects of HRT, good and bad. And then I know you've addressed this, right? But maybe just to sort of summarize that again. Yeah.
So if you're talking about the pros,
Yeah.
now look at the clinical symptoms. So to me, it's quality of life. Now, if let's say you have depression, right? Because studies have shown women in perimenopause, they suffer from clinical symptoms, all the symptoms of depression, at least 20 to 40%. And there's a huge number, right? Why suffer in silence? So seek help, look at the root cause, your nutrition. I'm just going beyond the hormones, right? Because hormones is not everything. You have to address all the 5 pillars, your exercise, your sleep, your stress management, your hormone balancing, your nutrition, and of course, a healthy diet. Gut health, so important. So serotonin, 70 to 90% is produced by our gut. So having a healthy gut flora, or all the microbiome, very important. Now, you have to look into the risk factor, family history, cancer, this, that. It requires monitoring, right? And it's very different. So you really have to chunk it down. It all depends on where you are.
Right.
And the mode of delivery. Like estrogen, we never give it orally, because oral, it goes to the liver. It breaks down to the different estrogen metabolite.
Okay.
I'll try not to be too technical, but just for education wise, there is 2, 4, and 16 hydroxy E1.
Okay.
E1 is not the good estrogen. When we are maybe menopause, our body produces that, right? And that leads to all, inflammation, weight gain, all those. So we need to know the mode of delivery. Hence, we give it transdermal. It bypass the liver, safer, and then physiological dose, a low dose. You don't give a high dose.
Yeah.
You balance it with the progesterone, the yin and the yang.
Right.
And you don't have to take it every day. So for most of my patients, I put them like from Monday to Friday, Saturday, Sunday off. And after some time, when they say, you know what, my symptoms are still there, I said, okay, take Saturday, Monday to Saturday, Sunday off. So you're mimicking the physiological. Like, when you're younger years, when you have your period, there will be a time where your body is like very low, when you have your menses, devoid of the hormones. So just try to mimic that.
Right. Okay. Thanks for clarifying.